Hello. It has been 3 whole years since I have posted to YouTube. I did not die. Um, Wait, is YouTube gonna get me mad at me that I said that? Whatever. Kind of felt like I did a couple times. Um, the pandemic has been something. Um, at the beginning of it all, I was pregnant, secret, didn't tell anybody. And we were trying to keep it private. And then pandemic hit 2 months before I was to give birth, so that was very stressful and very scary. She was born perfectly fine, healthy, 2 days early, just wild little thing. She just turned 3 yesterday. So I kind of felt like, I'm on YouTube every day. I watch videos, I watch music videos, I watch other people vlog. Might as well just put like an update. So when it comes to my daughter that I had made the other videos about previously, no, disability, we don't get it. My husband has thankfully left his shithole job and got a much better job with better people, better company, better benefits. Everything all around is just amazing. He makes twice as much as he did at his previous job. I was able to get a night job full time year round instead of working seasonally, so that has helped a lot. We don't get anything, and we didn't get anything all pandemic either. We got the extra money that they did for the child care credit, obviously, as everybody did, and we got the stimulus as everybody did, but we didn't get a drop of pandemic EBT. We didn't get any help in any regards with that. We lost our WIC during fucking pandemic, so that was fun. Um, yeah, because we were at that weird income level in good old America that we make too much to get help, but we're still fucking broke, and we make too little to really do well. So it's been interesting. We've been doing pretty good on that aspect. In the regards of COVID, we're COVID free. We have been for 3 years. We've not caught COVID once in my house, not my husband, any of my children, not my son or his father at their house. We've all been very careful and really safe. So that's very good. The biggest reason being because I don't know how often I had mentioned it that I am disabled and have chronic issues, that I don't want to deal with COVID. I don't know what that would do to me. I had a friend who knows somebody who passed away because they went through kidney failure due to COVID. They were perfectly fine. I already have bad kidneys. There's no way in hell I'm going to just be willy-nilly with my health and all that good stuff. My oldest daughter is disabled, and my youngest daughter has a heart murmur, and no, we're not playing these games. So I've been pretty much a hermit. I've pretty much stayed home. I go to work, and that's about it. And I'm content with that. Like, it's pretty much my lifestyle anyway. I don't like people. So isolation and pandemic was literally no change on me. The only thing that changed was listening to everybody else complain that they couldn't go anywhere. Because I don't know if I ever mentioned it, but because of my chronic kidney disease and my chronic UTIs, I was actually on macrobid antibiotics for a solid 2 years, possibly 3. So when you're on a long-term antibiotic like that, which by the way, everybody's very surprised I never developed C. diff, but this is why, I don't go anywhere. I don't do anything. If you tell me that my immune system is shit and compromised, and here's an antibiotic that is going to make you more compromised, I'm not going anywhere. So by the time COVID came around, I was like, whatever, cool, I could just stay home. Like, I mean, my house isn't the best location. I can't get shit delivered to me. Nobody can find it. I have a shared driveway. They leave it at the neighbor's house, blah, 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 blah. So, like, I still have to go out and do stuff, but I'm not going to concerts and all that stuff, like, at the height of pandemic, you know? So, pandemic was crazy because we didn't have primary care doctors for the first half. Like, the first year and a half, we didn't even have a doctor for the family or anybody because they kept closing clinics. They kept leaving, whatever the situation was. So finally, about a year ago now, we finally found a new primary care. We all got everybody in. Everybody got checked up. I got a couple more specialists added to my list because why the fuck not? My doctor even said, like, I asked her, I was like, why can't we just sit down with my doctors or my medical records or something at a panel group? I'll fucking pay for it out of pocket. I don't give a shit. And figure out what my problems are. Like, I'm so sick and tired of them shipping me to gastro. And then that's not the problem, so ship you to here. And that's not the problem, and ship you to there. And that's not the problem, ship you to there. Like, I wish it was like TV. I wish it was like the movies where everybody just sat down and was like, let's A, B, C, D, connect the dots and see what the hell's going on. But nobody likes to do that. So I've had a lot of shenanigans health-wise go down over the last 3 years. I managed to break my toe. I had to get staples for the first time in my life because I'm clumsy and cut my leg open. Um, I had surgery on my head a few months ago to remove some cysts. Nothing serious, just typical dermatology shit. The biggest headache has been doctor-wise my kidney disease. So I was diagnosed with, at the time they called it medullary sponge kidney and medullary cystic kidney disease, most likely UMOD1. Well, nobody will treat it. Nobody will do anything for it. I've been told twice that I'll see you when you need dialysis. I have a problem where my right kidney falls into my pelvis, and I have had this issue for years. An ER doctor was the one who said yes. I had a primary care physician who agreed. I had 3 years ago scheduled a IVP to get testing done to see if my kidney shifted. As I waited in the radiology room after fasting for 12 hours and sitting there patiently and politely, I had a nurse come in to tell me that the radiologist was canceling my appointment because I am too young. I am 30 years old and there's no reason why I would need to have this done, and I do not need to have this radioactive dye put into my body. There's no reason. And refused to speak to my doctor and just canceled it. So I never got that done. And then that doctor left the practice. That was at the very, very, very beginning, like middle of 2019. So then it's just been a shit show ever since. And I finally got to the point where I was tired of it. It hurts. My kidney hurts. Everything is fucked up. Like, I can't deal with it anymore. So I noticed in my records that my GFR had been dropping over the last 4 years at 10 points a year. And the average person only loses 1 point of globular filtration rate a year. So if my kidneys are slowing down to the point where they're losing 10 points of function per year, something's not right. But because I was still above that 60 point threshold, nobody cared. I have lost an excessive amount of weight since having my third child. I cannot gain weight. I cannot maintain weight. I weigh 144.4 and I have weighed this for 3 years. My norm is 160 to 165. So I have been underweight, but according to my doctors, no, I'm not. You're perfect. Your BMI is great. Okay. So I went to the doctor and asked, can I have a nutritionist? Can I see a dietitian? Can I see anybody to help me? I want to gain weight, and because of my kidney disease, I am not allowed to have protein, phosphorus, potassium, sodium, or calcium in excessive amounts. I have to watch all of those things. I also have very, very violent GERD because I had a Barrett's esophagus as a teen. So I can't have any of the acidic stuff, all that, the GERD diet stuff. I have such a limited diet to what I can eat that isn't going to exacerbate or aggravate anything that I basically have developed an eating disorder. Like, I'm not anorexic, I'm not bulimic, but I know that it's not right the way that I eat and how I eat, but what am I supposed to do? So I went to the doctor and asked for a nutritionist, and I was told that insurance wouldn't cover it because my BMI is fantastic. So, cool. I asked, well, can I see nephrology then? I need somebody to do something, to look at my records. And this doctor, mind you, this was my first patient appointment with her. Because again, I got switched. And she goes, I brought my paperwork with me from the urologist's office, like a stack, like this thick of my medical records, right? And she was arguing with me and she wouldn't even look at me. And I finally shoved the packet at her and was like, look through my blood results for the last 4 years. And as she's looking through and she was like, oh. Yeah, when you look at it on paper for one day, she has a GFR of 78. That's not bad. That's still good. When you look at the fact that that I had a GFR of 114 3 years before that, that's bad. There's no reason why it should drop that fast unless something's wrong. And they keep telling me nothing's wrong. So I went to nephrology. And of course, they sent me back to the same piece of shit they did the first time, who told me he wouldn't help me So I walk in, and I walk in with 3 discs of CT scans of my kidneys and all of my paperwork. He had a class resident with him who was, training or whatever. So I said, that's fine. He, in front of this resident, told me that he won't help me. Flat said, nope. I'm not going to send you to anybody else. I'm not going to send you to a nutritionist. I'm not going to send you anywhere. I don't think anything's wrong with you. You have this XYZ disease, which now they call autosomal dominant tubulointerstitial kidney disease, because it's an autodominant genetic disease. Only one parent has to have it. So he goes, yeah, you have that, but like, there's nothing we can do for you. It's a chronic kidney illness, and you already know all this. You've already seen me, so why are you here? Because I need help. I want to gain weight. I want to be healthy. I want a better quality of life. Like, come on, look at my scans. Look at my paperwork. Please look at this. He looks at me and goes, I'm not a radiologist. Why do I need to look at those? All I need is the report. And the report said, you're fine. And I looked at the resident behind him, and she was like we have masks on, She's wide-eyed. And I'm like, so you're telling me that you're not going to run a single test? You're not going to do a single image? You're not even going to do a physical exam on me? And I can just sit here and wait. And he goes, I'll see you when you need dialysis. Mind you, the whole time he's talking, he never looked at me. He was staring at his computer. And I looked at his resident, and she looked shocked that he would even say that. And I was like, you won't fucking see me ever again. And I stormed out and left in a rage. Like, they're lucky. Oh. So then I called my urologist and was like, nah, not cutting it. Something's wrong. Fuck off. And he literally tells me, verbatim, whatever you're feeling, you're not. Not whatever you think you're feeling, or you might have felt something and thought it was this. No. Whatever you're feeling, you're not. So I said, okay, thank you. Have a nice day. And I hung up. And I immediately called their Syracuse branch and was like, I want to transfer out. I am not going to this man anymore. He is insane. Because the FNP I saw through him quit in November of 21. November of 22. She quit just last year. So it was November of last year, and my FNP quits. And I get this letter stating that I'm not going to be seen. They have nobody to see me. Until they hire somebody new, fuck off, right? And I called, like, excuse me, I have my yearly checkup, I have my yearly ultrasound, I have my yearly CAT scan. Like, I know I have a chronic illness that's going to kill me someday and wind up 100% in dialysis and transplant. You can't just act like I don't exist because I'm not, like, well, because I don't have a dick and I don't have prostate cancer. Because let me tell you, this place is overrun with men and male patients. So, and I was like, what? And they were like, well, he would have to release your care and then you could transfer to Syracuse. So I finally, after a month, this motherfucker finally releases me and says, you can go to Syracuse. That's fine. I don't want to be your doctor anymore. Great. Cool. Releases me to Syracuse office. The Syracuse office, after 2 weeks, I call and I'm like, hey, any update on when I can get in, on my appointment? Like, any word? And the receptionist tells me that she spoke to my doctor, or who they thought that was going to be my doctor, and that I'm too complicated. She said that I'm too complicated, that they cannot handle my case, that it's just too much. They can't handle it, and they think that I would be better suited at upstate Syracuse, which is a wonderful system. That's the one my daughter has always gone to. So I was like, are you fucking for real right now? Like, a month ago, I had this fucking piece of shit gaslighting me, telling me that I was not feeling what I was feeling and that everything was in my fucking head, even though I have a psych eval from 2017 saying that I don't have a psychological problem. Thank you, endocrinology, for forcing that on me. And now you're telling me that I'm too complicated and I need to go elsewhere and that I need to go into a bigger system to figure out my issues and help me? And that fucking something. So in January, I was able to call and with insurance and everything and set up, a new patient appointment with upstate Syracuse. February, I had my first appointment. I walked in just like I do at every other appointment with my 3 CDs and my packet of urology papers to show everything, and I am a bulletproof bitch, and I don't give a fuck if the doctors and receptionists don't like it. When you have been gaslit your entire life to the point where you have PTSD from doctors, oh, you either curl into a ball and go into a hole and say, this is how I die and I give up, or you act like me and you come out fucking fighting, okay? I am 34. I have 3 children. I do not deserve to live in this chronic pain, in this chronic illness, with chronic UTIs, and all of my issues. I don't deserve this, and I deserve somebody who cares and who will help me and make it better. So, I walked in with all these things, and I sit down, and he goes, what's the problem? And I go, I believe that my kidney falls when I stand. And he asked why I would think that. And I tell him all the symptoms, and I go, I have my CDs actually. And he goes, oh, let me see them. I was so shocked. I've never had a doctor actually want them. Okay. So I gave them to him. He looked at the first one in 2016, perfect kidneys, perfect body. Everything looks great. That was before everything started. He looks at the next one. Okay. I can see why they diagnosed you with what they diagnosed you with. Yep. I agree with the diagnoses. That's what you have. Okay. Looks at the last one. Ooh, I see why you're concerned. That does look different. Puts them side by side. He showed me side by side. He showed me what's going on. Then this man stands up, has me move off the table, pulls out the paper, and draws a set of kidneys, and draws a nephrotopic kidney, which is what my issue is, nephroptosis. And he tells me everything that I've already WebMD'd, Googled, looked up, I already know. He sat there and he drew it and he showed me. And he told me that I wasn't crazy. And he told me I was right. And he said, I don't think we're going to need to do any more testing because you have history. Like, you have these images to show shit's been moving. But because of insurance, would you mind doing one more test? Like, is that okay? And I said, you know what? Yeah. Anything you need done so that I can get help, gladly. So I went in for a cystoscopy and a pyloregram. Not the IVP that they had scheduled before, but this was a different one. It was a catheter one. So I go in, they do the cystoscopy, which is where they put in a Foley, look at your bladder, make sure everything's healthy, and then use that to guide into the catheter up and go so that he can do what he needs to do. So he does that. Everything is fine. He puts the catheter in, and it was so funny because they're like, are you even here? As they're like scoping, going up and down and in and out and checking everything out. And I'm just laying there like, I'm good, whatever. And they're like, are you even here? And I was like, doesn't bother me. And the reason for that is because since, oh boy, everything started in 2016. I've had chronic disease for 7 years. And at this point, the neuropathy is just through the roof. I do not have feeling in my bladder most of the times. I don't have feeling in a lot of parts down there to do with the urological system because I've had chronic UTIs to the point where my nerve endings are dead. So no, doesn't bother me. You do you, buddy. Whatever you got to do. So they put the dye in. They go, okay, we're good for dye. Let's do it. So you're laying down and they do the dye and then they very slowly pick you up and then they take a picture and then they pick you up and they take a picture and they pick you up until you're vertical with your feet down. This group of doctors was so excited, and it was like something out of like House or Grey's Anatomy or whatever. Like, they were literally like, look at that. Can you imagine that? Look at, like, oh my God, look how, like, that is so clear cut. That is so evident. Like, my doctor says it looks like a kitten. So what happens is, and I'm no good at making and editing videos, so I'm not going to like boop edit up the doctor thingy here, like pretend it's there, right? That when I stand, my right kidney drops from position down into my pelvis at a 90-degree lateral on top of my uterus, kinking my ureters, kinking my blood vessels, and causing diabetes crisis. It doesn't always happen where I have a diabetes crisis. A diabetes crisis is where it cuts off the blood supply and the nerves, and you're just like, and you hit the ground. Like, it's awful when I feel it shift just right, and because it's like its own little alien in there. I call her Regina. The ER doctor named her that actually because of Mean Girls. It was really funny. So her name is Regina, and Regina just flops, does whatever she wants. She goes wherever she wants, does whatever she wants to do. I do have a video I will probably post up, and then like link it to this of just last week me laying on the couch explaining to my 3-year-old what is going on and why I have to have surgery. Because that I'm getting to. Because I have a video that shows that when I lay down on my back and then I lay on my side, you can see my kidney come down. And then when I lay on my left side, you can watch it drop, and it's now dropping past my belly button into my left hip. So the pocket that it's created to move is just getting bigger and bigger and bigger. And I have a very physical job. I work at Walmart. I am a stocker. I pull pallets. Literally, I'm stupid and I checked. They weigh 2,200 pounds a piece, and that's a Civic. Like, I don't know if you know this. That's a Honda Civic. So my job is to pull Honda Civics around the store and stock shelves with merchandise that are heavy as fuck. You know, gallons of water, 8 pounds. When you're sitting there shooting an entire pallet, your arms get pretty buff. I have a straight solid 6-pack. I'm all muscle. I'm toned. I'm lean. I'm maintaining my weight. I've checked off everything to do with what you should do for this illness and disease and issue prior to surgery. And nothing's helping. It's all for nothing. So after seeing this drop and just being like astounded that like it's so obviously in your face, he asked me if I would be okay with being a part of a medical journal. And I said, absolutely. So I don't know what is going to come of that. If it's going to be something that he writes up and publishes after surgery, because obviously that's going to be a part of it. But the main reason I'm making this video is because I want to make a journey of my nephropexy. Today I have 8 days until my procedure. I am nervous. It's an understatement. I've had a 4-hour surgery before to take my wisdoms out because they were impacted, and I have a heart condition, so I had to be fully sedated and in hospital for that, for safety reasons. So I know I can handle the anesthesia. I know I can handle it. I'm afraid of the recovery because I have to have a drain like they do for like plastic surgery, because the pocket that isn't going to have my kidney falling anymore is like, yeah. So like, I'm not excited about that. The procedure is going to be done with a Da Vinci robot, so fingers crossed that it stays that way and that nothing goes wrong, because then they have to go old school and they'll have to just slice me open, which isn't going to be fun. So what the surgery is I have to have my kidney reattached. They have to, so my kidney, when I stand up, your kidney is supposed to be up in here behind your rib cage. My right kidney, currently I can feel it right here. She's right there. Usually she'll fall completely and lay hip to hip right here. So basically the surgery is going to be 5 laparoscopic cuts so that they can take it, yoink it, like from here, drag it up behind my liver, and then they have to create a pocket behind my liver and in between my ribs and my liver, and shove my kidney up in there and then suture it permanently in place so that it never falls down again. I like to describe this as making my kidney into a nice little chicken cordon bleu. You take your chicken breast, you make a pocket, you shove the ham and Swiss in there. All done. That's what they have to do, but with my kidney, my lungs, all that good stuff. He's going to have to put it just a little bit lower than normal anatomy so that my diaphragm and my lungs still have room to move with ease and comfort. It does have an 85% success rate, so very, very, very slim chance of it not working. And yeah, that's all I really know about it right now. That I'm not crazy. That's number one. Every single time that I've been told I'm crazy, I was right. They're just pissed that I have rare genetic diseases. I'm sorry, but why are we surprised? I'm a ginger. Okay. So, in conclusion, life has been crazy, life has been wild, it has been up, it's been down, it's been bad, it's been good. There's been a lot of shit going on a familial basis that I don't think I'll ever put on YouTube. At least not for a few years, just for the fear of repercussions, because people are cray-cray. But yeah, that's been the biggest one. And I am finally getting it fixed. And I will be out of work for 2 months, and I will be laid up all summer, enjoying doing a whole lot of fucking nothing, while my kidney gets put back where it belongs. I hope all of you have a wonderful day, and remember to advocate for yourself. Nobody knows you better than you know you. Don't ever let anybody tell you that they know you better.